We all know people who can eat fast food for breakfast, lunch, and supper, drink no water, eat no fiber, and still have one or two good solid bowel movements every day. And there's other people who can eat nuts and seeds and salads and fiber and berries and fruits, take magnesium supplements, take laxatives and stool softeners, and they'll struggle to go once or twice a week. Now, fiber and water are never a bad thing from a healthy bowel function point of view. But if they were the main or even the critical factors associated with healthy bowel function, then the people who eat the fast food all day would never have a bowel movement, and the healthy eaters would go every day. And that's just not the case. So what's the difference? There can be physiological and metabolic factors affecting bowel function, and inflammation is one of those factors. Quite often, the people who struggle have some inflammatory issues in the lower bowel, where the people who don't struggle don't have those same issues. In this video, we're going to explain how the inflammation mechanism can lead to constipation and subsequent gas and bloating and lower bowel issues associated with IBS, sometimes even diarrhea. It can also relate to more serious inflammatory bowel issues, such as Crohn's and colitis and celiac disease. It also relates to other metabolic issues in the body, weight, chronic fatigue, mood and anxiety disorders, hormone imbalances. We're also going to show examples of how sometimes the foods you think are helping your problem can actually be causing the problem. Things such as probiotic-laden foods, certain fibers. There are cases where these can actually trigger the inflammation and lead to the problem that you're actually trying to fix. Everything in the body is related to everything else. If something can trigger inflammation in one part of the body, it can trigger it in any other part of the body. This is a theme you'll see in this video and most of the other videos on this channel. The conditions that the inflammation leads to are different, thus we get different diagnoses. So let's talk about poop. So before we talk about the inflammatory mechanisms for constipation, we have to talk about some of the mechanical and structural ones. These need to be ruled out before we start investigating inflammatory food issues. We have to consider things like adhesions, people post-surgery when they've had abdominal surgery, hysterectomies and things like that. You can get adhesions in scar tissue form from the bowel to adjacent organs, the bladder, the urinary tract, the vaginal tract. Imagine someone has a hysterectomy. Well, all the organs in a bowel and everything starts to shift around into new positions. We can think of things like torsions, twists and turns in the bowel because of the things I just mentioned, but also because of injury, unusual exercises, and so forth. We can think of neurological issues. Again, this could be post-surgery if someone has a section of their bowel taken out. There's a nerve plexus, a nerve network, like a hairnet wrapped around the bowel. This is what the nervous system used to control muscular movement of the bowel to push food through the system. It's a key component of what we call peristalsis. If we cut through that nerve network, that can impair the motility below that point. And we can think of medication side effects. We know, for example, opioids, morphine-based drugs can cause a histamine release in the bowel, which can cause constipation. This actually ties to a food issue as well, which we're going to talk about shortly. And also obstructions because of masses in either the bowel, things like tumors and things like that, but also masses of other organs. If we imagine a fibroid in the uterus pressing up against the bowel, or a mass in another part of the peritoneum or the abdomen can actually press up against the bowel and impair function there. Quite often when people come to me, they've already had scopes and scans and physical exams with their doctors. And once we're confident that those have been removed, then we can start to dig into the food sensitivity and inflammation issues. Now, there's a broad range of what people perceive as normal from a bowel function point of view. We're not going to talk about it from a Bristol stool chart classification point of view. We're going to talk about it from a functional point of view. A key part of my intake form with patients is digestive function, bowel movements, and so forth. And quite often we have people come in and that is blank, yet they have all these other inflammatory problems going on. And I never trust it. As soon as I start digging in, I always ask people, how do your bowels work? Quite often they'll say they're normal, they're regular. And I dig in a little bit further and I'll find out that they'll say, well, they're very regular. I go once or twice a week and I've always done that. So that to them is normal, but that's not normal. If we think of an animal, a puppy, when you get a puppy and you feed it, what's the first thing it does after it eats? It goes outside and has a bowel movement. And they'll do that 2 or 3 times a day, depending on how often they eat. Every time we eat, everything in our GI system should get pushed down a slot. So if we eat 3 to 5 times a day and we have a bowel movement every 2 to 3 days, the math simply doesn't add up. We have 15 to 25 inputs and 1 output. Something's not working properly in that scenario. And we have what I call treated normal. This is where people say, I go every day, provided I eat prunes and drink gallons of water and eat lots of fruits and vegetables and take magnesium and take stool softeners and laxatives. Those are wonderful things to manage the symptoms of the constipation. But as we mentioned in the introduction, there are people that don't do any of that and they have a good bowel movement every day. So if we took those management techniques away from that person, likely there would be constipation. And then there's what we call functional normal. This is where you go every day, no issues at all. Your body should force you to go at least once a day. People say, well, when I travel, I can skip 3 or 4 days and so forth. That's not even optional. It doesn't have to be urgent. It doesn't have to be hard or difficult. It doesn't have to be loose, but it should be a nice, normal, easy to go, solid bowel movement every day. And it shouldn't require a newspaper and half an hour on the toilet to go. It should be nice and easy and smooth. This is what I would call functional normal. And this is what we strive for from a bowel function point of view. If we can get to that point, we typically can assume that the chemistry and the gut flora and all these other factors affecting gut function and bowel function are in check. To understand how inflammation can affect bowel function and constipation and gas and bloating, we have to understand the terms mucous membrane and mucous membrane inflammation. The mucous membranes are any tissue in your body that has a slimy mucous film over it. If you run your tongue along the inside of your cheek, you can feel a slimy, thin mucus there. That mucus will go up into your sinuses, it goes down your lungs, goes down the whole digestive tract right through to the rectum. It lines the urinary tract, it lines the vaginal tract in women. You can think of it as your internal skin, basically. The same way we have skin on the outside of our body to protect us from dirt and bacteria and viruses, we have to have an internal skin. Our digestive tract from the most of the rectum is an open tube to the environment. We have to have an internal skin on that tube to protect us from those same things that we have to protect on the outside. Now, mucous membrane function, there's 4 critical roles we're going to talk about in this scenario. 1 is the barrier, the internal skin that we just talked about. 2, it has digestive enzymes in it. Enzymes are proteins that go in and hydrolyze and break apart and chop up food so they become small enough to get absorbed through the intestinal wall. The mucous membrane is a critical part of our immune system. Every time we eat, breathe, and drink, we get bugs and bacteria and viruses in our system. The mucous membrane has antibodies in it, which are soldiers at the gate, you can think of, to protect us from these things that we ingest and eat and breathe and drink. And the mucous membrane is a lubricant. These last 2 components are the critical aspects to understand in terms of how food can trigger inflammation, which can then cause constipation. Now, the mechanism for how food can trigger constipation through an inflammation process is really simple to explain. The mucous membranes, if they get inflamed, they tend to get swell and get red and puffy and so forth. If we think of a sinus congestion, we've all had a sinus cold or a head cold at one point. The sinuses get inflamed, the mucus lining in the sinus gets inflamed. When it gets inflamed, it swells up, sort of gets puffy. And what happens, it closes in and we can't breathe through our sinus properly. The other thing that happens is the mucus, the viscosity of the mucus changes. It gets sticky and goopy and sort of snotty. The mucous membranes in our sinuses are consistent with the mucous membranes in our lungs, our digestive tract, the urinary tract. So if something can trigger inflammation of the sinus and cause constriction and changes in the mucus viscosity, it can also affect it in any of those other mucous membranes. Now, if we think in the colon, what can happen, if the colon is a big round mucus-lined elastic tube, it'll expand when stool's in there, it'll constrict when stool passes out of there. If we take that tube in the colon and inflame it, and the tissue gets red and swells up, the diameter of the tube closes off. The other thing we talked about was the changes in viscosity of the mucus. The mucus gets sticky. Well, if you have a big round mucus-lined elastic tube, we shrink the diameter and we take away the lubricant. How is it going to be to pass stool through there? This is a simple way that inflammation from food can trigger constipation. There's a known mechanism for this phenomenon. We're going to talk about it shortly with respect to morphine and how that can actually relate to a food. So food sensitivities can create inflammation. Inflammation can lead to this constipation mechanism that we talked about here. If we look here, you can see the swelling and so forth that's happening down in the lower bowel. What can happen with this is we can start to get incomplete voiding, incomplete evacuation of the bowel. We don't poop enough. There's residual stool that's left in there that should be eliminated on a more regular basis. The bowel is a trash compactor filled with yeast and bacteria. What we don't digest and chop up and hydrolyze and absorb in the upper part of the bowel goes down to the lower bowel to become dehydrated and compacted so we can poop it out. The key component of the lower bowel that does this compaction and basically breaks the food down to compacted form is our gut flora, the bacteria and yeast that we tend to read and hear a lot about. If we don't completely void and evacuate the bowel on a regular basis, the gut flora that goes and creates that will continue to ferment and break it down. The gut flora doesn't break things down by hydrolysis. It doesn't break it down by enzymatic chopping. It does it through fermentation. And fermentation is a key component when we start talking about gas and bloating related to constipation. So this impaction here will lead to further fermentation or exacerbated fermentation, which will then lead to gas and bloating. Now, the inflammation causing the constipation will cause other problems as well. Inflammation will change the pH and the integrity of the mucus lining in the digestive tract, especially the small intestine and the colon. When we start to change that chemistry, the pH, the acid level, the integrity of that mucus lining, this can start to lead to imbalances in the gut flora. We hear of good and bad bacteria. We hear of good and bad yeast. Generally, most of them are good, provided they're in balance with each other. What happens when they get out of balance is when we start to see problems. So what can happen, this inflammation can lead to what we call a dysbiosis, an imbalance in the gut flora and the GI tract. This can lead down the candida pathway in the lower bowel, which will increase the amount of yeast that we have here, which can then in turn increase the fermentation. Candida has been a buzzword in natural health circles for as long as I've been a naturopath. The sort of new candida is SIBO, which stands for small intestine bacterial overgrowth. This is essentially just an imbalance in the gut flora, but in the small intestine versus the colon. Candida is a ratio problem of yeast to bacteria in the colon. SIBO is essentially a ratio problem of bacteria to yeast in the upper part of the GI tract. The symptoms are going to be fairly similar in terms of bloating and gas and altered bowel function. With SIBO, we tend to see more loose stool and diarrhea episodes. We can have constipation, but it's more loose and diarrhea. Candida tends to cause more of the other opposite problems. The key point here, though, is the dysbiosis, whether it's bacteria in the small intestine, candida in the lower bowel. The root cause for what's causing that imbalance is an inflammation, a change in the chemistry in that gut. The SIBO and candida will lead to increased fermentation and thus increase gas and bloating. Another mechanism for how the inflammation can affect gas and bloating. The inflammation can directly affect enzyme production. We talked about this in our reflux and indigestion video. An inflammation of the stomach lining will lead to gastritis. Gastritis means gastric inflammation, stomach inflammation. The inflammation of the stomach can actually impair cells in the stomach wall that produce hydrochloric acid and other enzymes needed for protein digestion, fiber digestion, and things like that. If we start to inflame the stomach with a food, we start to lose that enzyme production. Foods will then go down into the lower bowel in less than digested form, and the lower bowel will try and digest and break them down through fermentation. If the gastritis is bad enough, and we ultimately end up with some enzyme deficiencies in the stomach, one of the symptoms of gastritis will be reflux. This can lead to proton pump inhibitors or reflux medications, which will then in turn lower the acid even more. So there's a bit of a double whammy there. The inflammation can affect enzyme production in the wall of the small intestine. There are enzymes produced there as well that we need to chop up food for final absorption. So this inflammation can impair enzyme production in the upper part of the bowel and impair absorption, which will then increase fermentation and bloating in the lower bowel. There's yet another mechanism. Medications. If you look at most of the commonly prescribed medications for cholesterol, blood pressure, pain management, and so forth, and if you look at the potential side effects for those, you will see digestive issues in almost all of them. One of the mechanisms for how these medications affect us is quite often they'll affect the chemistry in the gut, which in turn affects the dysbiosis, which will then in turn create all these other feedback loops to increase gas, bloating, fermentation, and so forth. And when you look at this diagram, it looks very confusing. The main point I want to make here is it's not just one thing that causes gas and bloating or causes constipation. There's a bunch of negative feedback loops that sort of spiral down and make the problem worse. And there's lots of other things that can come in and kick into this negative feedback loop. Now, candida and dysbiosis. Again, candida has been a buzzword for a long time in natural health circles. We're going to talk a little bit about it here. The food sensitivities lead to an inflammation. The inflammation leads to a drop in the pH, which is essentially an increase in acidity. So the bowel can become a little bit acidic compared to its normal pH. We have bacteria in here and we have yeast. Yeast are a spore-based microorganism. They're encapsulated in a little shell to protect it from harsh environments. If we think of a mushroom spore, it'll drop out of the mushroom cap. It'll go into the forest floor, floods, fires, droughts. It'll live through those. And once it's given the right environment again, it'll pop open into a new mushroom. Bacteria don't have that protective casing wrapped around. They're very weak and unresistant to harsh environments compared to the yeast. So if we have an acidic environment created by this food allergy, it'll tend to drop the ratio of the bacteria to the yeast. It doesn't mean you're full of yeast. People will come in and say, well, I don't have yeast infections. I don't have thrush, but I still have other symptoms of it. Well, it's not because you have too much yeast. It's because you have too much yeast in relation to the bacteria. This is the candida picture here. We have a slightly higher yeast load to a lower good bacteria ratio. This leads to the candida picture. Now, most people have heard of candida or candidiasis, especially if you've been poking around natural health circles for any length of time. And candida naturally tends to be managed through a few mechanisms. One is diets to starve the candida. No sugar, no dairy, no fructose. These diets are basically intended to starve the candida. The Candida protocols will recommend often supplements to kill the yeast, caprylic acid, boric acid, Candida flush kits, and so forth, designed to kill the overgrowth. And the Candida programs always include a probiotic component. Now, when we do these three things, quite often we see improvements. The problem, though, is the Candida was created by an inflammation and a gut chemistry problem. None of these aspects down here address that primary problem. So if we take probiotics, we take supplements, we stop eating sugar and fructose, and we see symptomatic improvements. Quite often when we go off that protocol, which tends to be unsustainable for a lot of people, the symptoms ultimately will come back because it didn't address the primary problem up here. If we can identify those food sensitivities, correct the pH and the chemistry in the gut, repair the gut lining, and then we go and do the Candida protocols, they'll be much more effective. We'll have to do them for a shorter period of time, and we won't have to do them as often. Now, I mentioned before the opioid example in terms of how it impacts our bowel and how this can relate to a food issue. Here's the bowel. We take morphine. It comes in many different forms, but it's a pain medication. The morphine comes into the bowel and binds to a morphine receptor, a receptor in the bowel designed to bind to morphine. Once the receptor is bound, it'll do a couple key things here. One is it releases endorphins. This is what takes the pain away with the pain medications. This is also what some people have addiction issues with. The other thing that happens is it sort of activates a mast cell. It's a little cell in the body filled with histamine, and it breaks that mast cell open and releases the histamine in the bowel. The histamine is it's a protein that causes redness, swelling, itching, hives. That's why people take antihistamines for seasonality type symptoms. If we get the redness and swelling in the bowel, the diameter of the bowel closes up, and the histamine changes the viscosity of the mucus and it makes it sticky. So this is where we get opioid-induced constipation. So why am I talking about morphine with respect to food sensitivities? Well, casein, which is a milk protein, when we eat it, it breaks down into something called casomorphin. And what does the last half of that word sound like? This casomorphin can actually bind to these same receptors and trigger the same mechanisms. So we've all heard of people when they eat cheese, they might get a little bit bunged up or a little bit constipated. Cheese is very high in this protein casein. So that mechanism can actually trigger that problem. This can also explain why some people crave cheese and dairy products so much. We might get a bit of an endorphin response through the same mechanism. Now, with the food sensitivity model, we can see how it can affect the digestive tract. We talked in the reflux video about reflux, indigestion, heartburn. We've talked about how it can affect the bowel. The mucous membranes are in the sinuses, they're in the lungs, they're in the digestive tract, the urinary tract, and the vaginal tract in women. If we think of the mucous membrane inflammation triggered by food, there's a really good chance it's not just triggering inflammation in the colon and causing constipation. So if you look back through your history and your symptoms, have you had problems with reflux? Have you had sinus problems? Have you had breathing problems? Have you had urinary tract issues, urinary tract infections? Quite often, they're triggered by the same mechanism. So by figuring out the food issue that might be affecting the bowel, there's a really good chance you're going to see some other benefits from it. Now, the terms food allergy, intolerance, and sensitivity are tossed around quite loosely in natural health circles and conventional health circles as well. But there are some critical differences in these terms and the definitions which make or break whether people figure their food issues out. This is a key focus of the work I do with my patients, is understanding these different types of reactions. Food intolerances are simply when we don't digest and don't absorb a food properly. Think of lactose intolerance. Lactose is milk sugar. Anything that ends in ose is a sugar, glucose, fructose, lactose, etc. Normally, all sugars are absorbed in the small intestine right below the stomach. People drink lactose. If they don't have enough of the enzyme lactase to chop up the lactose, that big load of sugar doesn't get absorbed in the small intestine. So it goes down into the colon in undigested form. The colon is a trash compactor filled with yeast and bacteria. So what does yeast do to sugar in a warm environment? It ferments, and it ferments very quickly. The bowel will fill up with gas and fluid to the point where it can't fill up anymore, and the bowel will cramp and spasm, and they'll tend to run to the toilet with loose stool, cramps, gas, and diarrhea. So again, the lactose didn't get absorbed. It only affects you in the GI tract. It doesn't get into the bloodstream. So it can't go and cause inflammatory problems elsewhere in the body. It'll typically be isolated to the bowel. It'll happen within minutes to an hour or two after eating the food. So the cause and effect is always there. Once you poop that food out, your whole system goes completely back to normal. So it's a quick onset, quick recovery type of thing. The other key point here is I never mentioned the word immune system once in this whole explanation. You didn't digest the food and absorb it in the small intestine. It went down into the lower bowel, it fermented, and you pooped out the fermentation byproduct. There's no inflammatory response there. Now, food allergies and sensitivities, they are immunological reactions to food, which can lead to inflammation. They can happen anywhere in the body. They can affect you in the GI tract. This is what happens with celiac disease. Someone eats gluten. The antibody in the bloodstream produced to the gluten goes back and cross-reacts with a tissue in the bowel that looks like gluten. That antibody cross-reaction can happen in another section of the bowel. They can actually do celiac biopsies in the esophagus and the stomach. So it can affect you anywhere in the GI tract, but these antibodies are produced in the bloodstream. So that same antibody that's affecting the bowel can affect all your other mucous membranes, but it can also affect your muscles and your joints and your skin, your organs and your glands and these other parts of the body, whereas a food intolerance, it can't. A food intolerance will happen right after you eat the food. Well, a food allergy can as well if it's what we call an immediate hypersensitive reaction. This is the anaphylactic class. A kid eats a peanut, their throat swells up really quickly. As someone eats a scallop, they vomit 15 minutes later. But a food allergy can actually affect you days to weeks after you eat it. And these are called delayed hypersensitivity reactions. These are the same antibodies that are produced to a vaccine. We're going to talk about that more shortly. In a food allergy, it can recover very quickly. The anaphylactic responses can last minutes. If a kid eats a peanut and they don't get an epinephrine shot and they don't die, their throat will typically come back down to normal within 3 to 6 hours. The IgE antibody has a very quick half-life of about an hour to 3 hours. The half-life of the GNA antibodies can be 30 to 90 days. So an inflammation caused by those, it can take a week to 2 weeks to kick in, and the inflammation can linger for weeks to months after that. The key differences here, though, the food intolerance are non-inflammatory food reactions. The food allergies are inflammatory ones. And if we're talking about an inflammation of the colon leading to constipation, we're talking about allergy or sensitivity. We're not talking about intolerance usually. Now, allergies can lead to intolerances. You can eat a food today that can inflame your stomach next week. So when you eat spicy acidic food next week, you'll have heartburn. And you're going to blame the heartburn on that spicy acidic food. And in fact, it was a food you ate the week before that made you react to the spicy food. You can see where this can get confusing for people to figure out on their own. Now, food sensitivities, we talk about them. The anaphylactic class, these don't just cause anaphylaxis in the back of the throat or vomiting with your stomach. Histamine can affect us in the skin. Some people, their digestive tract will be fine, but they eat a strawberry and they'll get hives a few hours later. Histamine can cause headaches. Histamine can cause brain fog, focus, and concentration issues. It can cause urgent loose stool, diarrhea, and bowel episodes. So histamine is not just seasonal allergy environmental issues, and it's not just anaphylactic peanut reactions. Another way to consider this, indigestion, heartburn, and reflux. The medications, the proton pump inhibitors, one of their mechanisms of action is actually an antihistamine. And if we think of nausea in the stomach, one of the medications we'll take for that is called dimenhydrinate. More common names would be something like Gravol or Dramamine. The mechanism of action for those drugs is actually an antihistamine. Food sensitivities, the food allergies are associated with an antibody called immunoglobulin E or antibody E. These are the antibodies that tend to release histamine. And again, these symptoms will happen within minutes to hours usually after you eat the food. Food sensitivities are called delayed hypersensitivity reactions. Delayed is the critical keyword here. This delayed aspect of this type of reaction is what confuses so many people with respect to some of their inflammatory digestive issues and inflammatory issues elsewhere in the body. These are antibodies GNA. These are the same antibodies produced to vaccines. These are the same antibodies typically associated with most autoimmune conditions. It triggers inflammation through a different process than histamine does. It's cell-mediated. Histamine is a chemical that kind of gets released in an area and inflames everything around it. Cell-mediated inflammation, the antibodies in the cells actually target specific tissues in the body. So it's a very highly targeted and highly specific type of immune response, whereas the histamine tends to be more generalized to a local area. And the antibody production for this type of response, the antibody production can take 2 to 4 weeks to reach its peak, and the antibodies can last for days to weeks, sometimes months and years, especially for vaccines. In short, what can happen here, you can eat a food today. You could have a symptom from that food up to a week to 2 weeks later, and that symptom can linger for several weeks after, all from one food ingestion. So the differences between sensitivities and allergies, the IgE food reactions are typically called allergies in the medical system, and these others are called sensitivities. But the technical definition of an allergy is an immune system response, a white blood cell response, reacting to an antigen, producing an antibody. So technically, GNA antibodies can't be produced without that same mechanism happening. So in my view, they're both allergies. The anaphylactic class are immediate, the delayed type are delayed. The allergies are termed allergies because it implies a bit more urgency to them. The sensitivities, they tend to be more irritants. But in my view, the sensitivities are just as dangerous. They can cause dangerous low-grade inflammatory problems, but they do it in a hidden kind of way. Whereas the anaphylactic class of allergy happens as soon as you eat the food. So in my opinion, they're just as important, if not more important, than the anaphylactic ones, because those ones we can typically identify fairly quickly. So in graph form, let's talk about the food allergies. If we eat a food, the IgE histamine response will happen fairly quickly and it gets out of your system fairly quickly, minutes to sometimes hours. Quite often we can already figure those food issues out. Not always, and I'm going to explain why. The delayed response, the delayed allergies, you can eat a food today that can reach its peak 2 to 4 weeks later and then can take weeks to months to get out of your system. If you eat a food today and it bothers you next week and you don't figure that out, what are you going to do the next day? You're going to eat that food over again. So the antibodies don't rise from zero. They start to build up and compound on top of each other. This can lead to a low-grade chronic inflammation that you'll never correlate to a food in your diet. Whereas with the anaphylactic class, you'll typically see the response fairly quickly to that. Now, the chronic inflammatory response that we just talked about can actually hide and mask the histamine reactions. You can have a histamine reaction to a food cause a symptom, and you can have a delayed reaction to another food cause the exact same symptom. Now, what happens here, the delayed reaction, because it takes a while to get produced and then it lingers for a long time, it can actually mask the immediate response. These allergies can actually cover these ones up. So people will say quite often, I don't have any histamine issues because they think, do I eat a food and do I have the symptom right away? Another way you can think of this is if you have supper tonight and you don't feel well after, you don't technically know if it's what you ate at supper tonight or what you ate last week sometime. If we identify and get rid of the delayed responses, and then you have an issue after supper tonight, then we'll know it's what you just ate at supper, and it's much easier to backtrack and figure that out. Food journaling with the delayed allergies, you can have a 3-day response to one food, a 5-day response to another food, a 10-day response to another food. Because of that delayed response, you never correlate those things, so you keep eating those foods on a regular basis. How is food journaling ever going to figure that out? It's very difficult. So what's the next step from a constipation point of view? Eat more fruits, eat more fiber, take probiotics, etc. That's not necessarily a quick fix. What we're going to do now is show you some examples of sensitivity testing that we did on some patients who had constipation as part of their symptom profile. ELISA testing is a gold standard test method used in the hospital thousands of times a day. When a doctor does celiac testing on you, they do ELISA testing to identify the IgA gliadin antibody and the transglutaminase in that system. They use ELISA testing for antibody titers, for immunoglobulin assays. They use it to identify various proteins in the blood, various inflammatory and autoimmune markers, various infections in the blood, viral infections and bacterial infections. It's a medically validated test procedure. It's just it's not typically done for foods other than gluten. Now, what happens with celiac disease, someone eats gliadin, they produce an antibody to it, meaning they're allergic to it. The antibody goes back in the bloodstream, goes to the bowel, and it finds a protein in the bowel that looks like gliadin. And you get a cross-reaction. It's called molecular mimicry. Now, why couldn't a different person with different genes and DNA be allergic to a different food protein and a cross-react with a different tissue in the body? But unfortunately, they don't test for all these other foods in our system here in Canada. And here's an ELISA test done on a 36-year-old, not a 34-year-old woman. She had constipation, she had chronic urinary tract infections, and she had heartburn and reflux and nausea, some pretty severe gastritis. If we look at her test results here, we can see a dairy issue, casein and whey right here. Now, all food allergies are protein-based. Allergies in milk would not be to lactose. This is a big thing that confuses a lot of people. She had a major casein and whey issue, showed up here also in forms of cheeses and yogurts, etc. She also had an egg issue. She had a caffeine issue. And she had a banana, cranberry, citrus, lemon and orange, and pineapple issue. Now let's talk about this. If you have chronic constipation issues and you start searching for answers, a lot of people end up in the probiotic realm. And most people's first foray into the probiotic world is to start eating yogurt, Greek yogurt. Well, yogurt has probiotics in it, but yogurt also has casein and whey in it. You can be eating a food that may have probiotics in it to help offset the inflammatory response in the bowel leading to the dysbiosis. But that same food could have the inflammatory triggers that are actually causing the inflammation leading to the dysbiosis. So you can see where this isn't going to be all that effective. And we tend to think, let's increase our fruits and vegetables. Well, look at her fruit issues right here. Another thing with her is, remember, she had chronic urinary tract infections. Look at her cranberry rate. Now, the generic recommendation for chronic urinary tract infections would be cranberry juice. She was actually taking cranberry juice and cranberry extract pills for her recurrent urinary tract. She had a sensitivity to it. This is very common. She also had gastritis, nausea, and reflux. Now, the natural remedy for that is to use digestive enzymes to help increase your stomach acid to digest your food properly. Most of those enzymes are all made from bromelain, which is a pineapple extract. She had a pineapple issue. So there's a few examples there where she was taking supplements and eating foods to help her conditions, where those specific supplements and foods are actually triggering your condition. This is a very common phenomenon. This is a test result of a woman who was suffering with rheumatoid arthritis, had some digestive issues, constipation and reflux, also some anxiety, chronic fatigue issues, and so forth. We look at her test here. We can see egg is a big issue. Dairy wasn't an issue with her. If we go down the list, blueberry and cranberry, and gluten. Now, what I want to point out here is this is an IgG sensitivity. When people see gluten on a test, they think celiac disease. Celiac disease is an IgA issue with gliadin. Gliadin is a different protein in the wheat products. Gluten showed up in her test, but she had been tested for celiac and it came back negative. She didn't have an IgA reaction to gliadin. She had an IgG reaction to gluten. Now, this happens a lot where people will eat gluten. They'll feel unwell. They'll eat gluten before a test. They'll have a celiac test done and it comes back negative. And they'll be told they don't have a gluten issue when in fact they did. They just didn't test for the right antibody. We have to test for both G and A antibodies. They are starting to do some G testing in the conventional model here as well. So she didn't have celiac disease, but she did have a gluten issue or wheat, basically a wheat-based issue. She also had almond and some seed issues here. If you have a chronic constipation issue, we look at probiotics. Now, probiotics in yogurt probably would have been okay for her because she didn't have a dairy issue. So she would get the benefit from yogurt. But then we might start to think, well, I'm going to put on my yogurt, I'm going to put some flaxseed and chia seed. And you can see that probably wouldn't have helped her. Flaxseed, chia seed, oatmeal, some of the water-soluble fiber foods are a common first foray into people in supplementing fiber in their diet. The seeds wouldn't have worked for her. And here's a test result done on a 47-year-old friend of mine. His main issues, he had some cholesterol issues. He was a healthy, fit guy, and he had high cholesterol. He was on a statin drug, and he was having some side effects with a statin drug, some muscle pain, which is a fairly common side effect. He had a little bit of a history of reflux. He had some constipation, and he had a gout issue, again, which is a liver issue. Cholesterol and gout are both liver issues. Prior to his testing, he started on a bit of a health kit, and his main issue was he wasn't a big breakfast eater. So he thought I should do breakfast. So he was doing yogurt and oatmeal. He would put some things in his oatmeal to make it taste good. He had a gout flare up, so we did some testing on him. If we look at his test, we can see dairy, proteins, whey, and casein again were big issues. And again, he had implemented yogurt as part of his healthy routine. And he had some oat issues. Now, barley and malt showed up as well, but these are just cross reactions with the oat on the assay. Now, if we think of oats, if you think of what oats are marketed for, they're a water-soluble fiber. They're good for bowel function. They're also marketed as being good for heart health and cholesterol values. He was a healthy, fit guy. He had a high cholesterol and a gout issue, which are liver issues. So even though the generic thinking is that oats are good for liver, they're not good for everyone's liver, and they weren't good for him. Now, interestingly, just as a little side note here, he also had a cinnamon and a ginger issue. And what was he putting in his oatmeal to make it palatable? He was putting cinnamon in there. So from a constipation point of view, adding oatmeal and adding yogurt to his routine was not going to help his constipation. So we had a 36-year-old female with constipation. Her profile was dairy, egg, a bunch of fruits, caffeine, and ginger. We have a 52-year-old female with rheumatoid, but also constipation. Her issues were gluten, egg, a few fruits, almonds, seeds, cinnamon, and ginger. We have a 47-year-old male with cholesterol, gout, and constipation. His issues were dairy, oats, cinnamon, ginger, again, and yeast. So the key point I want you to take away from this can be why these generic one-size-fits-all diet approaches and supplement approaches sometimes don't work for us. We can be told to take a food for a certain symptom, when in fact we can have a sensitivity to the food that's actually creating the symptom. Your ideal anti-inflammatory diet is unique to you and you alone, and it won't necessarily fit with these generic diet and supplement recommendations that you're going to find with respect to your health issues. So what are the steps we need to go through to figure all this out? The first step, we have to identify and remove these delayed hypersensitivity reactions. As we talked about before, these are the ones that kind of compound and overlap. These can create ever-increasing and overlapping and long-lasting inflammatory food reactions. Step two, if we can do that, is then we can start to identify the histamine reactions. Now, the reason why we do it in this order, if we identify the delayed reactions, sometimes that can resolve most people's issues and we don't have to start looking for histamine reactions. But if we do the delayed food work and we figure those out, and there are still some lingering issues, that's where quite often we have some underlying histamine reactions to foods that we have to figure out. You can have delayed reactions to some foods and histamine reactions to completely different foods. Once we identify the histamine reactions, and if there are any symptoms that are left over, then we can go in and start to do leaky gut repair work, mucous membrane support, probiotics, gut flora balancing. Now, this is where most people step into this whole process. If they have issues, we go to the health food store, we take a probiotic, we take leaky gut supplements, and sometimes we don't see great responses with it. If you have someone outside your house drilling holes in your wall, on the inside, you can put paint and spackle on that hole. But until you get rid of the guy on the other side of the wall drilling the hole, it's just going to keep coming back. So when we're younger, sometimes those reparative supplements can mask the symptoms fairly well. But as we get older, we go through andropause and menopause. Our body's ability to repair that damage wanes quite drastically. So that's when these supplements start to work less effectively. And we're left with nothing but figuring out the root cause of the problem or the guy on the other side of the wall. The order we do these things is critical. If we do step 1, and it resolves everything, we don't have to do step 2 and step 3. If step 1 doesn't resolve it all, then we have to go to step 2. And if step 1 and step 2 resolve everything, we don't have to necessarily focus on step 3. If we do step 1 and step 2 and we get some response but not complete, that's when we can have confidence that the leaky gut repair, gut flora balancing protocols that we can use, they work more effectively, and we likely won't have to do them for as long. So this is why this order is critical. So what's next? People say, well, I'll just do an anti-inflammatory diet, or I'll do some food journaling. There's a reason why those anti-inflammatory diet programs may have failed you. The diet didn't fail you. Your genes and DNA failed you. What we're allergic or sensitive to in our diets is actually predetermined by our genes and DNA. The receptors on the white blood cells, they're protein-based. That protein is coded by your genes and DNA. So we can have 10 people with reflux, indigestion, heartburn. They can have 10 different sets of foods that may be contributing to their inflammation problem. So this is where a lot of those generic diet programs that we read, if we try them and they don't work, it just means that diet didn't happen to fit your immune system. Generic healthy isn't always healthy from a diet point of view and even from a supplement point of view. So I'd really encourage you all to go to this video right here. There'll be a link in the description for this, called Trouble with All Anti-Inflammatory Diets. It points out and explains this genes and DNA and allergenicity problem very clearly. It talks about how these one-size-fits-all generic anti-inflammatory diet programs and supplements, why they don't work for everybody. It'll show you some very specific examples of some patients who had the exact same problem, be it reflux, IBS, whatever it may be, and they had completely different inflammatory food profiles contributing to their condition. It'll show you examples of people eating anti-inflammatory foods, which are actually triggering their inflammation. It'll also show you examples of people using anti-inflammatory supplements, myself included, that actually caused inflammation. We'll see actual test results for those patients as well. It'll show you very clearly why generic healthy isn't always healthy. I also have an online course available. There'll be a link for this in the description as well, that outlines all the steps that I use with my inflammatory food patients in clinic. It provides all the technical background information on the definitions for intolerances, allergy sensitivities. It talks about the genes and DNA and how they impact our inflammatory food profiles. It basically explains everything I explain to patients and about inflammatory food issues in those first 2 or 3 visits I'm with them. There'll be a link in the description below for that. Now, none of us want to be allergic or sensitive or have inflammatory reactions to foods in our diet, especially foods that we love to eat. But that doesn't mean these foods aren't bothering us. We're far better off to know these reactions versus not knowing them. So I encourage people to go down this pathway just to figure it all out. It doesn't have to be a lifelong sentence. We want to figure out what foods are causing what problems, so when you go about your life and you make those choices, you'll know what the cost will be. Denial about these things isn't a good health strategy. Thanks, and we'll see you in the next video.